Headache is one of the most common complaint because of which patients present to the clinic. We can categorize headache disorders into secondary headache disorders and primary headache disorders. Secondary headache disorders are secondary to underlying pathology like infections, inflammatory disorders, cancers, cervical pathologies, while primary headache disorders are due to neurotransmitter imbalance, which results in sensitization to the pain sensitive structures. Secondary headache disorders can become life threatening, while primary headache disorders result in significant morbidity, that is, they affect the quality of the life. If a patient is having headache, minimal headache, and he takes a simple analgesic, pain subsides, that is okay. But if a patient is having persistent headache, severe headache, new onset headache, more than 50 years of age, headache in immunocompromised group in case of pregnancy, and if headache is associated with fever, loss of consciousness, seizures, then consult an headache specialist to rule out underlying serious pathologies. When the patients present to the clinic, first and foremost is history. We need to look into the duration of the headache. Since when the patient is having pain, where is the pain, what is the type of the pain, and associated features like nauseating sensation, vomiting, any visual aura like flickering, difficulty with lights and difficulty with sounds, fever, and we need to go into the examination details. Based on the history and examination, we need to evaluate accordingly. Investigations include like MRI brain along with MR angio, MR venogram, CSF analysis, and based on history and examination, we might need to look at the spine by MRI cervical spine, and we might need to take the help of other specialties like opthal to look at the fundus and to look at the optic nerve with the help of optical coherence tomography. And if we suspect any ear infection, we might need to take the help of ENT. And if any surgical management is required, we might need to take the help of neurosurgery. Treatment depends upon whether it is secondary headache disorders or primary headache disorders. If secondary headache disorders, we need to treat the underlying pathology, while in case of primary headache disorders, we need to decide which primary headache disorder it is and at what frequency the patient is having headache. Based on that, for immediate relief, we can treat the patient with pain relief medications and if needed, preventive medications.